Welcome to using online technology to teach communication skills to clinicians, residents, and students. And a special welcome to all of our colleagues around the world who have joined us today. I'm Barbara Lewis, the managing editor for DocCom since June of last year.
And I'm Christoph Detweiler. I'm an associate professor at Drexel University College of Medicine in Family, Community and Preventive Medicine. But I built my career really on the development of e-learning resources for medical education. And so this is how I came to Drexel after I was at the Dartmouth Medical School's Interactive Media Lab in 2001 to bring DocCom from an idea into reality.
And thank you for doing that, Christoph.
Yeah, but Barbara, could you tell a little bit more about your background?
Oh, thanks, Christoph. I began my career writing for national publications, and then I segued into marketing, and what I'm calling Act 3 of my career. I'm working to improve the patient experience after spending 2 weeks in the ICU with my sister, who tragically passed away 3 years ago. I received a grant to research what medical schools are teaching around the patient experience, and I interviewed you, Christoph, and Dennis Novak about DocCom. And that was about 1.5 years ago, which really impressed me. DocCom was very, very impressive. And at the end of the conversation, you asked me if I'd be interested in submitting my resume for the managing editor position, which I was very interested. And here I am with the best job in the world, helping learners improve communication skills, which I realized was critical to the patient experience when I was in the hospital with my sister.
Oh.
So I had very big shoes to fill. Bill Clark was the first and previous managing editor, and thank you, Bill, for everything that you've done for DocCom. The webinar is going to last about 30 minutes. The recording will be available on the DocCom website shortly. And if you have any questions, you can type them in the chat box, which is located in the panel, usually appears on the right side of your panel, of your monitor, I should say. And if we don't have a chance to get to your questions during the webinar, we will respond afterwards. So with that, let's get started. Today we're going to talk about the description of DocCom, a little bit about our background, the importance of communication, and then Christoph's going to take over with a tour of DocCom. Our mission is to provide engaging educational resources to enhance clinician and patient communication and health outcomes. DocCom is a proven online interactive healthcare communication skills learning system. And I realize that probably many of you are familiar with DocCom, but I see that a number of people have signed up for this webinar that I don't recognize, and you may not be familiar with DocCom. So here's a little explanation about who we are. In 2003, the faculty of AACH and Drexel University College of Medicine decided to look into forming DocCom, or something that would help learners become better communicators. DocCom obtained a grant from the Arthur Vining Davis Foundation, and it was launched in a pilot in 2005. We just celebrated our 10th anniversary on June 1st, and it debuted as a nonprofit in 2006. We were very fortunate this year. In April, we began offering CME, and I'm going to talk a little bit about that later. We've had some very prestigious partnerships over the years, which we've really enjoyed. We've also been published in a number of journals where studies around communication have shown the value of DocCom. And if you're interested in any of these, I'll be able to send them to you. I'm sure you probably all know the importance of communication skills, which is really the foundation of building a great relationship with a patient. Research has proven that great communication skills improve medical outcomes, that they save billions of dollars on unnecessary tests and procedures. The good communication skills decrease malpractice claims. It enhances physician and provider satisfaction and also enhances patient satisfaction. And finally, it improves the CAHPS scores. So there's two types of CAHPS scores that is administered by CMS. And if a hospital or a physician group accept money from Medicare, then they are mandated for hospitals, mandate for physician groups are coming soon, to obtain patient satisfaction surveys, send out patient satisfaction surveys and get scored on what those surveys reveal. So the H is for the hospitals and CG is for the clinician groups, the physician groups. And two of these dimensions on the surveys have to do with communication, one of them with physician communication. And further research that's been done has shown that those communication dimensions are the predictors for the scores for the HCAHPS, for example. So if you get high communication scores, generally your HCAHPS will be higher. The result is financial. CMS actually gives money and takes away money from hospitals that have high communication scores, or higher scores, I should say, or lower scores. So there's actually money at stake now for communication. A little overview about DocCom. The module authors are leading faculty. We have 42 multimedia-rich interactive online modules. There are over 400 videos of realistic interviews. We also have annotated interactive videos, which Christoph will explain a little bit later. Assignments for the learners, assessment questions, a grading matrix, resources, and curriculum guides for the faculty. We are currently in 3 foreign languages, Japanese, German, and Portuguese, and Spanish will be coming soon. As I mentioned, in April we obtained CME, and physicians can now earn more than 39 credits, I should say, which is the equivalent to hours approximately, and that is through the Drexel University College of Medicine. We have over 75 institutional subscribers with over 20,000 learners. Our program breaks down into 56% are medical schools, and of course this is where we started 10 years ago in medical schools. But we've seen this huge migration lately into residency programs. And if you are affiliated with a residency program, let me know, because I've had some fascinating interviews with the heads of residency programs and how they're using it. We'll be having a webinar in a few months for resident programs, specifically interviewing people on how they are using DocCom in their programs. We've had some terrific testimonials over the year, all of which over the years, which you can find on our website. So with that, let me turn this over to Christoph, and he's going to begin with a tour.
Okay, let me try. Let's go to the first slide of the tour. So DocCom was conceived around 2000-2001. In 2002, there was a Kalamazoo report and an Institute of Medicine report, both laying out what constitutes communication skills in healthcare. And so when this became available, it served as our blueprint, because faculty from the American Academy of Communication in Healthcare were involved in both of these reports, and the idea was to create like a super actual, like a textbook of the 21st century that takes advantage of everything that is available at this moment. And so we just started also with a similar kind of structure then outlined in the Kalamazoo report and the Institute of Medicine report. So we start with basic modules and essential elements. These both are mainly what we teach in the first year. So I'm also a professor and teach communication skills and use DocCom, so that gives me a little bit of a perspective to using and to develop it when further when I see something is not working. So the advanced elements are then more specific situations, like all kind of things, and then we have really the specific situations, and then communication with colleagues. And this gives us 42 modules. let me see. I mean, you can go into the DocCom site. It's at when you just Google DocCom, you find it immediately, and you see the whole table of content. And there are also 4 open and free modules. So all of these modules have really a consistent format. It's modular. So first, there are kind of an introduction, and later we see that there is like a patient who tells a perspective, what's going on in their mind, and then the physician, what's going on in the physician's mind. And at the very top, there is like a rational, only 40 seconds, that should ignite the interest of whoever is watching the module, and to allow them to find this kind of real interest. Barbara, if you would go to the next slide, please. Okay, so here is an example. It's just a video, but as I said, if you go Google DocCom, go in there, you have 4 modules and you can check it out. So the patient's view, the idea is after the rational, where we learn why it's important for us as physicians or other healthcare professionals, why it's important for society as a whole to learn about the issue. We hear a patient telling us what's going on in his or her mind, and then after that, we see a physician telling us what's going on in his or her mind, and the idea is that we understand when there is a discrepancy between what they find to be important and necessary for communication. Each of these modules also comes with reflective questions, later key concepts. Barbara, it's the next slide, and then also the learning goals are defined for each module. After the learning goals are defined, we go into the core of the module that is specific to the topic. So it goes into an advanced content. This example is about the 5 A's, like smoking cessation or any kind of behavioral change that we would like to attempt. And it has also links to the references. So each of these modules are referenced heavily. The authors are all faculty from the American Academy on Communication in Healthcare, and they are renowned experts in their field. So I think that was also important from the conception of DocCom that enabled its success. That we did not want this to be an in-house production. We really aimed at getting the best to us known experts coming to Philadelphia, doing the videotaping, and have them really to provide us with high quality texts. And there was a panel of editors helped them. That is Ron Ziso, Dennis Novak, and Bill Clark. Now Bill Clark is no longer, no, he still works for us, but it's now Barbara Lewis, who's the editing manager, the managing editor. Barbara, would you like to go to the next slide? Hello. Okay. Literature preferences, you can go one further. We have videos embedded throughout. So there is a little bit of a lag, but this is natural for these kind of webinars. So there are 2 different types of videos that we are using. There are very short ones, vignette videos that show something that is very clean, clear, and should just give us a hint. The most successful, in my opinion, is the attentive silence one. None of our students was able to show attentive silence, but in Module 6 by Julian Bird, he does a great job in showing attentive silence. And just after assigning to watch, to work through the module, and certainly to watch the vignette video, how attentive silence is looks like, our students are now much likely to try it out and deal with it. Even so, before that, teachers had huge problems of first year.
Christoph, we're having a hard time hearing you. I'm not sure what's happened to your audio, but we're having a difficult time. At least I am. Yeah, the webinar is breaking up, somebody told me. Can you? No, we can't hear you. Can you talk?
Yes, I'm talking. Do you read me? I am talking.
You're breaking up,
I am
actually.
talking.
Okay, that's better?
Oh, God.
Okay.
Yeah. Is it better, though?
Well, now it sounds as though you're on a speaker. No, that's not better.
Yeah. Okay.
Okay, that's better.
Okay. So I reset my USB headset. Okay. So let's go to the next slide. Then soon you're back to talking, and then everyone can hear you, I guess.
Yes, that sounds great. Thank you. We're on the annotated video example.
Okay, the annotated videos. This is really something special. I developed them in 1998, so it's a long time ago. And this is one of the reasons why I was asked to join the team and to bring DocCom from an idea to a real product. I developed that the annotated videos as a mean to transport expert knowledge. So while watching a video, it lightens up what is going on, and sometimes you see there are special icons to these annotations, and when you click them the main video stops and annotated video appears, and then a video annotation appears, and the expert tells us what is going through his mind, why he's doing what he's doing, why she's doing what she's doing, and so on. So there you find like the expert knowledge explained to us, you find street smarts, and you also find pearls of wisdom. And that is really a very attractive format to not only role model what's going on, but to explain the role modeling that is going on. In all the surveys, we found that this is the most highly valued component of DocCom. So now you see one of these little video annotation popping up when such a video annotation is being clicked. So the main movie gets darker in the background, and the expert tells us something interesting, hopefully, in the forefront. And when he or she is done, the small video disappears and the main video continues playing. Okay, so this is now we get to the next video, the checklists. At the end of each of the DocCom modules, you find a checklist with the effective behaviors listed. And so we assign our students to work through the DocCom modules before we meet them in the hospital for a bedside teaching session. But before we go to the patients, we meet with the students, talk over what they found interesting in the DocCom module, and also check if they realize the issues in the checklist, if they memorize them, if they understand them, if they are likely to use them, to apply them, and we do that also in role plays and stuff like that before we go to the patient ward. Barbara, next slide, please. Assignments. So there is a learning management system also available on DocCom. And this is a system that allows not only to sign up users, but to help in the connection between faculty, facilitators, and learners. It allows to build learner groups. Everyone can create a learner group in DocCom, but they can also be built from administration, but it's also a grassroots system. So everyone can just build one and invite others to join the group, and the one who created it becomes a group administrator. As a group administrator can send assignments to the group members and receives access to see how they did on the assignment. So these are short question answers and also MCQs. So here you see a short answer question. So the discussion question in 1 or 2 paragraphs summarize what you have learned from this module, and we go through that and check it out. And before we meet with the student in our blended learning setting, we look at that. Now we look at MCQ question. There are also MCQ questions for most modules. I mean, 9 out of 10 modules have MCQ questions, but I guess most of you know how hard it is to write good and meaningful MCQ questions. Okay, so as an administrator, a group administrator, or an institution administrator, you can see how your students are doing. And always in DocCom we do color coding. So you go and you see how the questions to the different the answers are coming back, so you know where the learners have problems, where they are okay, where you need to explain more, that they have the better understanding of the right answer or not. And you can always look at the users level, so you don't, of course, I mean, this is, but it's there. So, and what's neat, you can also provide them directly with feedback. So when you read through their short answer question, you can provide them with feedback. So I really like your reasoning, interesting thoughts, this is how we do that, and you can grade it there. They don't see the grade when you submit feedback, they just see your feedback. And then there is a feature that Barbara, she can offer her opinion on that, likes a whole lot, that allows us to color code for tons of students. I mean, this is done for the big Caribbean schools with up to 2,000 students, but this roster with the color coding allows to get just with a glimpse, see how the students are doing. Green is well, red is not so good, orange, yellow is iffy, and that focuses your view to see who's not doing so hot and to think about helping them get better.
I love this feature because when I was teaching communication at UCLA Anderson School of Management, I had this unwieldy Excel sheet that I had with all of the assignments and the grades, and this would have been fantastic. So on the left side here are all the names of the students, which we have hidden, and then across the top are all the modules. So you can see who's completed what modules and what their grade was. So in certain cases, you can see students that have not done well and that need perhaps remedial help across here on the modules. And then you can also see which modules may need more of a discussion because the grades are tending to be a little low, perhaps. I love this feature of DocCom.
Yeah, it's cool. I like it too. Even so, we don't use it here because at smaller schools, I mean, we have 270 students a year. So we are not a small school for American standards, but international standards. We are a small school, and we do that, communication skills build up and training in small groups. And there I use the short answer questions, and that provides me with much better insight, I feel, than MCQs that measure just knowledge. But when you have tons of students, you need other means to survey how they are doing, of course. Okay, I think I give back to Barbara. At the end, there are also resources. We provide through DocCom also our facilitator guides for DocCom residency doctoring curriculum and our complete physician and patient course syllabus, which was created by Dennis Novak, our associate dean for medical education, and he started these interview course at Brown, I think 30 years ago. He's a real pioneer, and he's behind all of that. I mean, he had the idea he was the one who wrote the grant for the Arthur Vining Davis Foundation and got it, and he hired me from Dartmouth to get this done. So he's the guy with the big vision to start with.
Thank you, Christoph. I know that some of you are on for the opportunities that exist with DocCom. We have Curriculum Challenge, which is going on, which we've done for a few years now, I should say. And this is an application for a chance to earn a free one-year subscription for your school or program. It's open to medical schools, residency programs, or PA programs. You can find out more on our website at DocCom.org. The deadline is November 23rd, and we'd like you to tell us how you plan to use DocCom in your curriculum. And every year we give away 1 or 2 subscriptions for an entire year. The other opportunity that I wanted to draw your attention to is a CME pilot that we have. So you know that we have CME now. And we're interested in 3 medical centers that would like to use DocCom to increase the communication skills of their clinicians. So we've developed a curriculum for 3 months. We've taken 25 of our 42 modules and put them into the curriculum, and we have a very rigorous protocol that we will partner with a medical center to hopefully prove that clinicians' communication scores improve after using DocCom. So if you would like to participate in that, you can contact me. Here's my contact information. By the way, you can receive a free 1-month subscription, and just let me know if you're interested in that. I'd be more than happy to give you that 1 free month subscription so you can find out more about DocCom. And by the way, all AACH members receive a free individual subscription. So we had a couple of questions, and let me just go over those quickly. Someone wanted to know if we are recording the webinar, and we are. It will be posted on our website along with the PowerPoint so that you can access this at some future time. And also somebody interested in the fact that I stated that good communication skills save billions of dollars on unnecessary tests. Wanted to know the source of that, and I'd be happy to provide that as well. So if there are no more questions or any other comments that you'd like to make, I'd like to thank you. Christoph and I would like to thank all of you on attending the webinar. The recording and the PowerPoint will be on the website. And if you have any questions or if you're interested in that 1-month subscription or if you'd like to participate in our CME pilot, please contact me. And thank you very much.
Thank you.
Goodbye.
So Barbara, you're still on?